Hello, Gut Check Project fans and KBMD Health family. Welcome to another episode of Gut Check Project. I'm your host, Eric Rieger, joined by the better host, Dr. Kenneth Brown. Ken, we have a guest today.
We do have a guest. In fact, this is our last episode. We sort of showcased about this. We got so excited about what we're going to be doing. And today we have the esteemed Dr. Austin Wendell on the Gut Check Project. Welcome, Dr. Wendell. Today, as we had mentioned in the prior episode, we're really excited. There's some really cool stuff going on. We're going to be chatting with Dr. Austin Wendell. He's a Texas-based expert in functional and integrative medicine. He is the founder and CEO of Vario Health and Naviwell Group. He's passionate about holistic health, wellness, thyroid care, anti-aging, gut health, and really improving health span. Now, Dr. Wendell is not just a skilled doctor. He's also an innovator and a speaker who's shaping healthcare's future. And we're going to talk about that. As I mentioned, he is CEO and founder of Naviwell Group, which I feel is going to be a complete game changer in bringing wellness to the masses. He's also super into working out and goes to the sauna a lot, which is how him and I met. So welcome, Dr. Wendell.
Thank you. Well, first and foremost, I appreciate y'all letting me hop in and speak a little bit about what we do and why we love what we love in healthcare. But more importantly, I get 2 episodes. So I actually got on here last time and this time. So I feel extra special.
Yes. We talked about you a lot, but you weren't here to defend yourself and all the stuff Eric was, talking about. So.
Just all the things.
I so bad I don't remember any of those things.
Just blacked out with
Yeah, like right.
Okay. I like it.
Can you give us a little bit about your background, how you ended up forming Vario Health first? Because I think we're going to spend a lot of time on Naviwell Group, but you do have kind of a cool background of why you ended up becoming the type of doctor you are, the background, all that stuff.
So background, a lot of it really started healthcare wise. I was going orthopedic route through school, actually even through high school. Actually fractured my back in high school and have a double spondy at L4, L5, which is fracture within the back. But from there, ended up going to see a chiro. And funny story, both of my parents got injured from a chiro back in the day.
Oh.
And when I was going through rehab and everything, they were like, you can do whatever you want, just don't see a chiropractor. And I was like, what? Long story short, fast forward through it, ended up seeing a chiro, changed my life, changed so many things. Got into chiropractic school, fell just completely in love with everything. But I realized there's so much we can do from the musculoskeletal side in the chiropractic world. And there's so much that still needs to be worked on from functional and integrative health that the traditional medical model, the Western medicine model that a lot of people are used to, still leaves a lot of people feeling sick, unhealthy, and just not right. And a lot of my family story comes from autoimmune thyroiditis, so Hashimoto's and Graves. Both of my sisters and my mom have Hashimoto's, and my dad has Graves. So I saw them and I realized, man, I can help with their neck pain really well. But in regards to everything else metabolic and everything else health-wise, we're really, really lacking, right? Their lab tests were normal. Everything else looked normal, but underneath they didn't feel right. And so that kind of pushed me into functional medicine. Obviously from football, I also had quite a few concussions, so I needed some work on myself. And it just led me to really fall in love with improved quality care with patients, right? And really spending the time to get to know people, root-based medicine, really understanding how the whole body works together as one ecosystem and how to treat it not just as individual parts, but one cohesive unit. And landed me into functional medicine and spent a lot of time, about 15 years in functional medicine at this point. When I was still doing it, it was really voodoo. And now I feel like there's so many people that are diving into functional medicine, especially in the last 5 to 7 years. But I've loved it and my whole passion built into it. Started multiple clinics, sold a few, entrepreneur at heart as well. And ended up going into consulting for quite a few years with a different group of medical providers. Ended up working with over 100 physicians, MDs, DOs, all across the lower part of the US, helping them understand how to incorporate proactive preventative measures within their practice. And then I decided, you know what, I'm going to just do it in my own practice again. So went back into practice, built Vario Health, have recently merged and took on other clinics and started a new clinic group called Wellness Clinics of America, rebranded it, and then growing. And obviously Naviwell spun off from that during COVID. Had a crazy idea with a business partner at a bar. We were eating some food and he was like, let's think of something new. I was like, okay, insert Naviwell, the whole napkin on a thing at a bar, and the rest is history. So a lot of fun and building up a couple different options for patients if they're in Frisco or in the surrounding area versus nationwide. Naviwell is growing very rapidly, and very thankful to see that happen. So
now we've had a couple discussions for people that are unfamiliar, especially a lot of traditional doctors.
Mm-hmm.
You've been involved in the functional medicine space for a long time, not just involved, but educating yourself and being part of an organization like IFM. And Eric and Dacia, we had a booth at the last IFM.
Mm-hmm.
And now you've kind of seen that evolve a little bit and change over the years.
Oh yeah.
So you've been involved, like you're like as young as you are, you're an old school functional medicine doctor. You've seen it.
Oh yeah. I remember, because obviously going through school, getting loans and everything, I would blow every single bit of extra money that I had on seminars for functional medicine. So I remember traveling and going to IFM, A4M when there was like 20 people in the room.
Oh, really?
Oh, like it was, I mean, Hyman was still teaching at those times, and there was a bunch of people, like some of the OGs, like some of the founding fathers of functional medicine were still teaching at those seminars. And I remember looking across the room, and there was 20, 30 people in the whole room. And now you go to them and there's thousands of people. And I'm like, what happened to functional medicine? And so, yeah, I remember, man, the amount of money I blew on seminars in school, it was worth it though. Got me where I am, but I love it. I'm just a student for life. I feel like as a physician, you quit becoming effective for patients when you quit learning. And so that's really something I've taken to heart, and I'll always continue to learn and be able to provide the best care for my patients and my businesses, so my providers and my businesses can excel and grow as well.
There's got to be an element, I think, what you described is like you were willing to dump, just staying within the confines of taking care of people traditionally in an easy way, and actually step beyond the means of what a lot of people would do at an early point. And you basically just described, I was there when there was 20 people, and now it's bustling and it's very busy, and there's a lot of folks. So, what is it like to, number one, get into an area where maybe you know that there's an answer there, but you're not seeing everyone quite connect to it, but year after year it grows because apparently you're speaking in functional medicine. Of course, I loved going to IFM myself.
Oh, yeah.
But from your perspective, from being there certainly longer than I've been going there, what is it like to see people begin to emerge and adopt? And now you know that it's got to be attracting an audience because it's becoming more commercial in certain aspects where it probably wasn't before. So what is it like to be kind of a trendsetter? And now it looks like you're taking the best part of those trends and merging it back with what some people use in traditional medicine.
Yeah. There's so much to that, right? The amount of depth that goes into that, it's just so rich with a lot of opportunity, right? I feel like really over the last 5 to 7 years, especially like right as COVID hit, and then the future of things as things have evolved through healthcare and medicine, there's so many people wanting answers, right? And there's a lot of people asking questions, and not just patients, but providers, right? You have so many physicians that are trying to really understand there has to be more than what I'm doing right now, right? There has to be some other tools that can help me heal patients, get patients better, and create a better quality of life, right? So I do think there's a lot driven from the physician side, but I think one of the things that's driving physicians to really want to learn more is coming from the patient side. We now live in a world where every single thing is here for patients. They're asking providers, they're asking physicians in their office visits, hey, what about this? What about that? And most physicians are like, I don't know. I really don't know what to tell you. So I think there's just so much out there that people are just striving to understand, right? And to get answers for. And so I think the more providers hop into functional medicine and understand there's so many other ways to create a collaborative effect of treatment and to help people, we're just going to see more and more transitions, not just from patients, not just from providers, but also from the payers, right? The insurance companies. We're starting to see insurance companies look into preventative, holistic, and integrative type services. It's slow and they're it's Titanic type movements, right? Slow and very, very hurtful in a lot of ways. But I mean, everybody's wanting to know more. And I think to answer your question, it goes back to people just have questions and they want answers. So providers have to do more to really be able to give their patients full success.
You know, in my world, when patients come to me and they've been labeled as having irritable bowel syndrome, and they just go, well, I had all these tests and it was normal. I still feel like crap.
Yeah.
I was told I have IBS. You know, that's kind of how we developed Atrantil, was just, you know, to fill in this gap of, you know, there's something more going on. Your story of this family history of having Hashimoto's and thyroiditis and things like that, when you said labs are normal, but they feel bad. Go into that from a functional medicine perspective. When somebody goes to a doctor and it's like, well, your labs are normal.
So from a functional medicine perspective, we learn to not just look at the lab values themselves, right? You learn to look at the patient as a whole, right? Yes, they might have properly functioning labs, right? They might be within the range, right? But without getting too much into it, what are the ranges, right? Are the ranges today the same as they were 10 years ago, 5 years ago? Where are we getting a lot of the statistical data on what those ranges actually mean? Why are none of the laboratories have the same ranges, right? So it's all relative is what I'm trying to say, right? And there's not a single provider out there that doesn't say they get a report from Quest, a report from LabCorp, a report from CPL, just talking about general labs, right? They're all going to have different stuff, right? And so trying to understand really the difference between when things look normal on paper, but somebody doesn't feel right, there are so many other factors that you're just not going to pull from a lab, right? And to be able to understand all the different intricacies of how the body works as a whole, to be able to understand just some of the basics, right? When you go into biohacking and stuff like that, everybody talks about how biohacking is so incredible and so important. I feel like a lot of people don't feel well because they don't do the basics, right? They don't move right. They don't sleep. They don't eat right. They don't hydrate like they should. They don't work through stress reduction. You can talk about biohacking all day, but you just go back to the basics and you're going to help people feel better, right? And so when I look at things looking right on paper, but people don't feeling well, or don't feel well, sometimes they're not pulling enough labs. Sometimes they're looking at this, but it's something else over here. It's being able to actually sit with a patient and say, we're going to go through this in detail. This isn't going to be a 10-minute appointment. This isn't going to be a 15-minute appointment. This is going to be a 45-minute. This is going to be an hour. This is going to be an hour and a half long appointment, because we're going to have to really dig down to see what we need to test, how we need to test for it, and then figure out what we need to do from there.
I think that's one of the reasons why functional medicine has taken, actually, I think it's one of the reasons why chiropractic medicine has grown quite a bit also, is because how many people I've met that have not even had a doctor spend more than 5 minutes with them due to the system. Not an attack on the doctor itself, but due to the system.
They don't have the ability.
Yeah, especially if they work for an organization that says you need to see 32 people in a day.
Yeah.
How many people have come in and they'll say, you're the first doctor that's actually touched me?
Sure.
Which I think chiropractors in the musculoskeletal space really did that really well for a long time. They were at least touching people. And I'm a huge fan of chiropractic medicine. I go regularly. My kids go. My son, whenever he comes back from college and he's injured, I'm like, you know who to go to. I got this buddy, Ron, that he goes to, and he works with athletes all the time. And so
he's
just says, he's just like, hey.
They do a great job there.
Yeah. And so, you know, they work on things like that, where my story on this is when I was in practice, I had horrible trap pain, like horrible, to the point where I was just sitting there just daily like this.
Yeah.
My wife's a PM&R and I'm talking to her and, you know, and so it's her thing. And then I end up getting an MRI on my neck and I end up going to an orthopedist. And then I had a pain guy inject it. And then I went to Dr. Tribendis, and first thing he said is, what do you do for a living? I'm like, oh, I'm a gastroenterologist. And he's like, oh, you do this. He's like, oh, come here. And then he did ART on my teres minor.
Yeah.
And 2 years worth of pain was gone. And I was like, that was so simple. And yet I've spent thousands of dollars and with specialists. And I'm like, wait a minute, we're missing something here.
Because he listened.
In time.
Does he listen to you?
Yeah, because he listened.
Yeah.
And then now we have this functional medicine where you just said it. We're not going to spend 5 minutes, 15. We're going to spend an hour. And we're going to talk about an in-depth look at your labs. And maybe they appear normal here, but is that your normal? When somebody comes in and says, well, your thyroid, your TSH is still normal.
Yep.
A thyroxine has never been checked. A reverse T3 has never been checked. And it's just, you're normal. And not to bash specialists, but I do think that endocrinology, and they're expected to see a ton of people also.
Yeah.
But if the lab is normal, then the patient is normal.
Correct.
And, I think we're moving away from that now. And I think that's one of the exciting things about a functional medicine approach.
Oh, yeah. It's funny because so one of my first practices was actually back in New Braunfels, where I'm from. And when I would sit down and I'd meet with patients, I'd figure out exactly what I needed to test, what labs we were going to do. And I remember I actually one time went to go do labs myself there to check some of my values and everything. And they looked at my requisition form and they looked at me and they're like, "Are you Dr. Wendell?" I was like, "Yeah." They're like, "Your patients are the only patients that come into this lab draw place that are excited to get their labs done." Granted, you pull 4 times what everybody else does, but at the same time, every single patient that walks in that's your patient, they are excited because they felt like somebody listened. And they know just because somebody's lab values are normal here doesn't mean that theirs are. And everybody has their normal. We're all different. We all have so many different factors that go into who we are and how we feel today that you can't cookie cutter medicine in any shape, form, or another. You have to customize, you have to individualize. And I agree with you. There's so many providers that want to do that. There's so many doctors of all specialties they want to. They just don't have the ability to do it. They don't have the time. They don't have the resources. I mean, they have to learn a whole new specialty, right? Functional medicine is a specialty. There's actually a medical specialty now that's recognized, lifestyle medicine. There's a whole new specialty that's now being recognized because it's different, right? And a lot of providers, they want to help people do more. I don't think there's any provider out there that I know. I've talked to, and I've worked with over 250 physicians at this point. They all want to help. They all have the desire to. They really just don't have the time and the resources. And that's why I created Naviwell.
One of the things is I think every doctor can agree that we have been taught to treat the disease once the disease is there.
Yeah.
I was never really taught to prevent the disease.
Right.
We were never really given the skills to do that. But because the actual industry itself thrives on that, it needs that. It needs chronic disease.
Sure.
To keep the big pharma going, to keep, the insurance companies going, to keep the hospitals going. It's all built around that. And that is one of the things that if you stop and take a step back and go, look what we can do from an economic standpoint,
sure,
on a national level, if we can just prevent diabetes.
Yeah.
Let's just say that one, obesity, diabetes, things like that.
And
so we're going to get into Naviwell in a sec, but I know that at Vario, you implement quite a few things. Like, what are some of the other stuff that you do at these clinics that which is now called what? You've rebranded?
Wellness Clinics of America.
Wellness Clinics of America. What are some of the things you do besides some of these labs? Because I know that you take on quite a bit.
Yep. So we do, and I want to talk about a study in a second about the diabetic study, and it'll kind of bring a lot of this more full circle. But at the clinics, we do anything from general primary care, right? Sick visits, all the way up through advanced functional medicine. So most of our providers will spend 30, 45 minutes, even up to an hour in the encounters. All advanced functional health. We do a lot of work with advanced thyroid issues. We obviously do quite a bit of weight loss as well. A lot of hormones. Obviously, we have chiropractic there. We do a lot of decompression, chiro, rehab. I actually have 4 personal trainers on staff there as well. I have 2 nutritionists and a dietitian on staff. I also have massage therapists. I have an entire support team that is incredible between our MAs, front desk, everybody there. The team there in replicating that model into the other locations that we're taking over and adding on to, it's really offering patients, and over 90% of our patients are insurance based, right? We're probably the only functional medicine practice in DFW that is insurance based, right? Because it's so hard to actually spend the quality time with patients and make money off of it, because like you said, you have to see 32 people today. There's no way in a functional medicine practice you're going to see more than 10 to 12, because it's draining, right? Not even just the fact that you physically can't do it, but it's also very draining and taxing on the body. And if it's all based off of that provider, that practice is never going to make it, especially on an insurance model.
Yeah.
You just can't. But So we do just about anything, anything with adults. Obviously, we're not with kids. We do refer to quite a few amazing pediatric offices that are in the area, but anything adult wise that's portal of entry, we refer to this one GI doc all the time. He gets a lot of our patients. Sitting on the other side of the
Some
table.
of them live.
Some of yeah, right. Some of them stick around for a while. We do a lot of referrals with specialists in the area. We get a lot of bidirectional referrals as well because I mean people know we care, right? And we try to do everything we can to improve quality of care and outcomes and keep patients there and make them not just make them feel right, but make them happy, make them healthy. And I think half of our providers are more counselors than they are providers sometimes because they get to a point where they just pour their hearts and their souls into patients, and it's a beautiful thing.
What would you say the best way is for someone to sit back and maybe they've never stepped into the functional medicine arena,
Mm-hmm.
and maybe they feel like they haven't quite gotten an answer, but they're not really sure if they're there and they're ready to take that leap to do something different or think
Mm-hmm.
outside the box. And for instance, let's just say if somebody has bloody diarrhea, someone's going to more than likely say you need to get a gastroenterologist, or I've got chest pain, I'm going to go to a cardiologist, or whatever that chain happens to be. But those seem to be like normal responses. Where should someone start getting used to saying, I need to go find someone that deals in functional medicine? What I don't think the answer is to wait until all hope is given up.
Right.
So how would you kind of start to reach out to people and say, this is the time to come and visit with us?
It's all about education,
Mhm.
right? And you have to change people's mindsets because so many people here, especially in America as a whole, everybody's reactive, right? Everybody is, I'm not going to do anything until it's this far, right? And they intentionally just push it off until they can't anymore. So it's really educating people to take the driver's seat. And that's really when we have people coming in that they're like, I don't even know why I'm here. I just want to get my annual visit and some labs. And we're like, no, we're going to spend more time, right? But it's really educating people on why you need to be proactive, why you need to be preventative, because our whole mind and everything around healthcare is designed to be reactive. Traditional Western medicine is a reactive medicine. And to try and get patients and even providers in that way to think preventative and to think proactive, it is all about education. So you have to, I tell all my providers every time when you get a new patient in the door or somebody's referring somebody in, if I'm talking to a patient and you want to get a friend in, you got to find their why, right? You have to find everybody's why. Is your why your grandkids? Is your why your children? Is your why you love to travel and you can't move like you used to, right? Or is your why your career that you're falling behind and you're more tired and you're not sleeping as well? And you have to find people's why. And if you can find their why, you really can change a lot of their entire perspective of how they think about their life.
The idea of entering something preventative, I think, is something not only huge for anybody who doesn't want to encounter disease, but I think nowadays if people is like young parents, what is it you're going to structure and set an example for you and your children?
Mm-hmm.
Whereas several decades ago, there's no type 2 diabetes. And now I think adolescent type 2 diabetes is over 20%.
Yep.
It's huge, and it's a metabolic disease. And that's only one facet of, I think, of what you're addressing. So if parents learned, look, I need to make a difference so that I can literally teach my children by what I'm doing, not just what I'm saying.
Yeah.
Then probably an investment in their own health through functional medicine would be much better.
In as many things that were suboptimal, we'll put it politely, suboptimal about COVID, I can confidently say we have had more people since COVID be interested in proactive health than we ever had before. There has been a decent size shift, and a lot of it is young parents. It's people in their 40s, 30s, and even late 20s that are like, you know what? There's actually something to this preventative thing, maybe. And there's, for all the negative things that COVID brought, there has been some positives because I do personally believe, and from our patients coming in, as COVID started to kind of settle a little bit, whatever it is, there was so many. Yeah, we're gonna just pass by that one. The whole point of it is to say there are so many people that have been interested since COVID to take more of the driver's seat for their health that I'm forever grateful, because we have had a ton of people come in because of that.
I believe that.
A ton. So there's a lot to it, and there's but it's a paradigm shift, right? And traveling to other countries, looking at different healthcare, looking at, and we can talk about healthcare systems and healthcare models in a different time, but looking at how we view it versus how other countries and other people view healthcare, we just have to create a paradigm shift. And that's what Naviwell is supposed to do.
It's really interesting because when we look at different countries that do have a socialized medicine type system,
yeah,
especially now because of the internet, because everybody has a phone, like we are doing really well in the British Columbia area of Canada because they can't wait 7, 8 a year to go see a doctor. So a lot of them take healthcare seriously into their own hands. They start looking at the natural solutions to different things. That's just one example.
Oh yeah.
Eric did bring up diabetes in children. You know, when I went to medical school, there wasn't such thing, and it was called adult onset diabetes. What was the study you were going to bring up about diabetes?
So one of the things that really got me interested in creating Naviwell as a whole was a study that came out between Medicare and Quest Diagnostics, and it was in 2014, I believe. And what they found was, if all they did, so they brought together, I think, a couple thousand diabetic Medicare patients, and all they did was sit them in a room and educate them on life with type 2 diabetes. So they did that probably twice a month for, I think, 15 months. And what they found at the end of the study was they averaged a savings of over $2,000 per patient in that study annually for diabetes. So that just shows you that we don't know, right? As patients, you have no idea what's going on in your body. What you're putting in there really makes a difference, and how to really take control and lead your health. And when you look at how many, do you even have any idea how many Medicare patients are diabetic at this point in time?
I don't.
Oh my gosh. Study for you to look up when you're done. But I mean, hundreds and hundreds of thousands of people all across the country that you look at. If you could save $2,000 a year per patient, how much money you would save just by sitting them in a room and talking to them about diabetes. So I was like, you know what? If Medicare is covering that, or if Medicare is doing that, then are other payers doing that? And at that point, is it just diabetes, or is there other health conditions? How can we take, and this is one of my biggest issues with functional medicine, is it's so expensive, right? When you look at functional medicine, the barrier, so many people that need functional medicine have zero access to the care, because it's anywhere from a decent functional medicine provider is going to charge $4,000 to $8,000 for a treatment plan. Granted, don't get me started on all the crazy diagnostics that they run that are overkill, in my opinion. But when you look at it, functional medicine is such a barrier to entry, because you cannot get 80% of the population that needs it can't get access to it because they can't afford that. So you have to be able to educate patients, to sit in a room with them, to be able to stay consistently in front of their face to say, how can I help you? How can we further educate you? Is it just brain fog that you have issues with? Is it your thyroid? Is it your blood sugar? Is it your cholesterol? Is it your mood, right? I mean, how many people is it just their mood, right? And how many people's mood is driven by their gut and their brain? Everybody. Single one of them. Yeah. So there's so much that you can really do in healthcare if you just educate people. Even Medicare knows that. Even Quest, everybody knows that. It's just we don't have the ability to sit in front of a patient and to educate. And most providers don't even know what to educate them on. That's the other tough part. Most providers are like, this is great. What am I going to educate them on? I mean, I'm not going to sit there and go through pathophysiology with them, because I've probably forgotten most of it at this point anyways. I know how to do this, this, and this. But from an overall standpoint of, let's get some global advice for this patient's quality of life and start working through returning back to how they should be, you have to be able to spend time with them. And functional medicine is the only solution to that until now. And with that, most people can't afford it. So what do? Right? People get sicker, people get worse, people get more chronic conditions, and then they get comorbidities. There's over $1.7 trillion in healthcare dollars go towards chronic conditions in America every year. I mean, the statistics are crazy. I just found another study that came out last year about chronic care and preventative medicine, and the amount of research that's pulled off of that, of just things that can be solved with lifestyle-based modifications. That's over 37% of the causes of death in America are from preventative issues that we could turn back time. It's crazy.
No, actually, on the last podcast, Eric pulled up your website and he actually read those stats.
Yeah.
On the last one. Quick question for you, because this is something that I'm seeing, and I think you're hitting on a really common theme here. It's that patients that have insurance, they go to the doctors that take the insurance.
Mm-hmm.
And I'm running into, because of my age, patient population, wife's friends, I am shocked at hormonal care and how all over the map it is, and how possibly the traditional doctors may not have been completely trained on it, because I'm seeing a lot of, let's just talk about menopausal or premenopausal hormone.
Yep.
How there's no, you get placed on something, come back in 6 months, let's see where you're at. And my wife's got some stories from some friends that would show up with hirsutism and everything because they were placed on some testosterone, but it's 6-month follow-up and it's all these things. So really quick on hormone therapy, that I think functional medicine doctors at least have spent quite a bit more time looking at, especially. And I have a specific question for you on this, because my wife was asking about this, the whole menopausal thing, like what you guys, I imagine, treat a lot of premenopause and menopause.
Tons.
Yeah. So like, what would be a typical protocol for that?
So again, that's the tough part about functional medicine. Is true functional medicine, there is no protocols, right? You cannot protocol hormonal health. You can have guidelines, right? We have general guidelines that I have trained my providers, and then they've trained the rest of them, that you can have guidelines to hormonal health for sure. And you can understand where to start, but it's so individualized that you can't have plug and play, copy and paste hormonal protocols, because again, you could have the same person that comes in, same female with low testosterone, right? Each one of those females might be coming in with different symptoms of the exact same issue, right? And then each one of them has a different cause for how it got there. So if you just throw the same treatment at every single one of them, yeah, maybe 30-40% of them are going to feel good. They're going to feel great. They're going to say, this is amazing. But then you're going to start getting other ones with side effects, and you're going to start getting that feel worse. And that's when you have to be able to, that's why traditional functional medicine, when you go back to joking around about 10 years ago, 12 years ago, when nobody was at these conferences, the conferences have actually changed from, here's the information, and this is what's going on in the patients. Take the time to understand it and to create actual customized plans with the patients, to here's protocols, right? Here's this, because there's so many providers in functional medicine now, and there's different groups, right? Take my courses. Here's my protocols. Here's my this. And I'm like, no, the fact that there's 12 doctors that all have their own functional medicine protocols, that they train other providers on their protocols, I'm like, that is ridiculous. That's not functional medicine, right? That's why even some of the OGs of functional medicine don't even say they love functional medicine anymore. Like I was speaking to one of the guys, he's actually the #1 speaking PhD for A4M, and I'm not going to name him on the podcast, but he doesn't even like functional medicine anymore. Like I was in a meeting with him probably about 4 or 5 months ago, and he says the same thing. It's like, yeah, I don't like it anymore because it's so protocoled that it's losing its reason why functional medicine was there to begin with, right? We can do a whole nother talk on that later, but to answer your question, you can have the same person with low T or high estrogen, right? That's causing some of these issues, that you have to not just say, okay, what's the hormone that we're going to give them and what's the dose, but okay, how is their blood sugar affecting this? How is their sleep affecting this? How's their hydration affecting this? How is their stress management? How's their home life, right? If you don't look at the whole picture to see why, right, then sure, you could just start throwing out hormonal dosing all you want, even if you see them every 2 months and do labs every 3 months, which is what a lot of functional medicine guys do, you're going to get some better. But I can't tell you how many patients have walked into our practices, or I've gone into other doctors' offices where the patients are on super physiological dosing of almost any hormone that exists, that I'm just going crazy with why they're doing that, but it's protocols. So you have to take the time to actually sit one-on-one with a patient and learn what is their causation, that specific patient's causation for why they have what they have.
So this is our sauna conversation when you and I met, which then led into going to your office and seeing what kind of a fantastic office you run, which then led into your discussion about Naviwell. So let's talk about Naviwell now, because as we get into this and as you hear everything, so everyone that follows this or has access to my clinic, I'm so excited about this because everything you just said that I've wanted to do, I feel like now I can offer, and I can still be a full-time gastroenterologist doing my procedures, doing everything, not taxing my physician assistant that's already seeing a ton of people. And now I can kind of walk the walk, because up until now, like Eric and I, we talk about this on the podcast all the time. We really try to eat a certain way. We really try to focus on our sleep. We try to do these things.
Yeah.
And in 5 minutes, I'm telling the patient, they're like, what should I do? I feel fatigued. I'm putting on weight. And I'm like, well, we're going to do this for your gut health. And they're like, but I'm also feeling like I'm perimenopausal. And I'm like, yeah, that's a little out of my scope, but it's also, I don't, unfortunately, I don't really have the time to get into that. And I've really kind of felt bad about that, because I get a lot of people that come that traditional medicine, go to functional, and then they spend a lot of money and they still feel bad. And then they come in. And now I'm realizing that, well, if I had a way to educate, to spend more time, to work on lifestyle, to work on preventative, and then you popped into my life.
A little bit of divine intervention.
A little bit of divine intervention. 2 sweaty guys in a sauna.
Yeah. I think we both had hoodies on that day. I almost passed out in the sauna that day because we just kept talking. I was like, I'm about to pass out in this sauna right now. 20 minutes later.
Let's get into this napkin concept called Naviwell.
Yeah. So Naviwell was designed to understand, and going back to that study that I just mentioned, as soon as I finished reading that study, that Medicare and Quest study, it really piqued my interest of what all can we accomplish within our current healthcare system to take a cash pay, cash-based functional medicine model and see what we can do from insurance, right? See what insurance can allow us to do. And then I just started researching CPT codes, diagnoses, how different things work together, how functional medicine can work within our existing structure. And the whole goal is to be able to say, I need to get preventative, lifestyle-based medicine to other physicians' offices, because I can't see them all on my own. I'm not going to open 500 or 5,000 wellness clinics of America, right? So what can I do that allows me to get in front of these patients and to continue to see them? And that's how Naviwell was developed. And sitting in a dinner with a buddy, who's actually my business partner now, Robbie and I were talking. He was like, why don't you take some of the things you're doing at Vario and see if you can actually unify them and reproduce them to other providers? So it morphed into us saying, how can we improve patient outcomes using objective measurable progressions, using support staff that works with the providers underneath the provider's location and management of the providers to offer education, movement, lifestyle, nutrition, to really say, provider, you keep doing what you're doing. We are going to bring in a full suite wellness solution to help support your goals for your patient care. And that's where Naviwell was created.
If you were to take someone today, let's say they were inspired, and you've referenced it twice, but because of the pandemic, now they've decided to look somewhere else for answers, and you were to have a traditional clinic
Mm-hmm.
that suddenly says, we now have Verywell as a part of our practice. We basically are seeing that you're not just wanting to be able to stop in and
Yep.
get a quick checkup for a cold or your shoulder hurts. No, actually, we want to prepare you that once you leave here, yes, we'll address your ailment, but you need to be doing these other things. And we
Mhm.
actually have this service inside. This is what it sounds like to me on how you actually have an an allopathic style practice grab on to what it is that patients are actually seeking to do. Nobody wants to be seen over and over again for an ailment over and over and just come back and do it again.
Yep.
And it sounds to me like what you're doing is you're more than filling the gap. You're giving people hope once they leave that we got you better. Let's get it so that you're not hurting going forward.
Yeah. I mean, the Naviwell, I make every single patient fill out a questionnaire when they first start with us. It's about a 40 to 60 question questionnaire that really gives us a big picture for what their health is, right? What are you struggling with? What are your problems? Where do you feel these symptoms? What's your medical history, your family medical history, right? So I take that questionnaire and I use that questionnaire to help us direct what we're going to be educating that patient on. And I have about 10 to 15 buckets that, based off of that questionnaire, each patient falls into one of those buckets. And once I figure out that bucket, we spend the next, depending on severity, so it's also scaled based off of severity of that patient. Depending on how severe it is, we spend 3, 6, 9, or 12 months with each patient, up to 175 different visits of education for that patient to say, what are your issues? How do we understand those issues better? How do we have a solution for those issues? And then actually have our staff work with you one-on-one to improve your quality of life, to improve your lifestyle, to improve your lifespan and your health span, right? Because those are two big different things. To say one-on-one, we have your back, we're here, and we're going to move forward with making you the healthiest version of you.
It's awesome. I mean, I think that's what a lot of people feel like that they were missing.
When I talk to patients about things like this, and if they say, well, I'm just really tired, I would like to eat better, I would like to figure out how to work out, I've never done this in my entire life, and I've tried, but the dietitian that you sent me to doesn't take insurance. I looked at getting a gym membership and then finding out that the personal trainer costs X amount and I'm on their time, those kind of things. So what you're offering with Naviwell is to place that in my clinic. So let's walk through a patient that I see.
Yep.
And I'm treating for irritable bowel, bacterial overgrowth, whatever it is that they came to see me for, even if it's hemorrhoids.
Yeah.
So I do a hemorrhoid, and then I have the opportunity to say, what else do you want to improve in your life? You know, like, I would like to have more energy. I would like to learn how to cook better. I would really like to learn what to eat. And honestly, I would like to start a little bit of some movement. I'm like, I have just this thing for you. We're starting something in my clinic, which fortunately, let's bring this up. So I'm a gastroenterologist in a large group called GI Alliance, and they have been remarkable because we've been working on this for 6 months.
Been a minute.
Yeah. 6 months, which has involved multiple Zoom calls, lots of lawyer meetings. And I have to commend GIA and Jim Weber and Nick Weber. It was Nick Weber that brought this up, for saying, you know what, we're an innovative gastroenterology group. We believe that we can change the payer situation, because if you come to GIA, we're trying to implement proactive things to keep people out of the hospital. We're trying to implement proactive things so they don't need expensive drugs. And they recognize that this could be a very important step on patient satisfaction, physician satisfaction, which includes online reputation. And the model that you have proposed is both cost effective for the provider, meaning it's not going to be a money loss on my end, which I still think it would be an okay thing if it's a money loss if the patients get better, right?
Patients get better, right?
GIA doesn't view that.
Yeah,
They just want to make sure that it's something that could actually be cost effective. And for the first time, I'm able to offer my patients something that you're already paying money for insurance. You can use your insurance to do this. And then over time, the insurance company will realize we're saving money by getting these people healthier. So person comes in, they've got rectal bleeding, I treat their hemorrhoids, and I'm like, what else is going on? Well, I'm, constipated. Okay, we can work on that. I'm fatigued. I'm putting on weight. Doctor says my labs are normal. And I'm like, you know what? On your way out, make an appointment with our Naviwell program here in the office. Walk me through that patient from then on.
Yeah. So from that point, that handoff, call it the handoff, right? Call it the handoff. With the Olympics just finishing up, I learned a lot about handoffs. So I'm actually going to start using it in some of my work with the offices. But handoffs are incredibly important, right? And when you look at from you passing the patient to us, the point from there is to say, let's keep that momentum from that patient who I don't feel right. Something is not okay. And I need, now that I'm interested, now that I just walked out of my visit with you, and you're like, you know what, he's right. I need to fix something, or this fatigue, or this weight gain, or this, I mean, just sadness, right? How many people that come in to see you are either depression, anxiety, any of those,
right?
Oh
my gosh. In the GI world?
And then, yeah, it's like all of them, right?
Yeah, unfortunately, because it's the gut-brain axis.
Exactly, right? The gut-brain axis is one of the biggest things in all of medicine that people overlook. And when you look at taking a patient that's coming out of your encounter to say, we have a program for you, we initially get that patient onboarded into our app. We send that patient that questionnaire. They fill out the questionnaire. It sends us a report that says, this is where you scored. This is where your issues are. This is what we will focus on and work with you on. We initially schedule that patient for their new patient onboarding, which at that appointment, we actually sit down with them and go through their whole report. We'll go through the report. We'll talk to them about their goals. When was the last time a provider sat down with you and said, what are your health goals?
Yeah.
Like, what are your overall health goals, right? Where do you see yourself from a health perspective in the next 5 years, 10 years, 20 years? Most providers never get the chance because of time to ever be able to do that. So from that point, we then say, we understand what your goals are. Now let's talk through how we're going to get there with you. So we set up visits with the patient weekly, biweekly, even up to every two times a week, where we will sit down with the patient and say, okay, let's start this process. And the best part is insurance covers it, right? When you can say, you're going to come in, we're going to educate you on a healthier lifestyle. We're going to spend time with you, getting you active, talking through your nutrition, talking about your conditions and how to work through those from a lifestyle perspective. Anything and everything we can to create further education. We're going to spend that time with you weekly. And then to top it off, insurance pays for it. Name the last time in the history of healthcare where insurance paid for a proactive preventative care. Never. And
so rare that a lot of the meetings that we had were with coders of GIA.
Oh yeah. They're like, what is this? What are these codes?
What are these codes?
How do these work?
And then they look it up and they're like, this is amazing.
This actually works.
This works.
Yeah. So I'm working with a group. It's up to 50 primary care offices in Texas. And the same thing, right? We stalled at the billing and insurance team. And they're like, there's no way this works. Like, we know all these codes, we know everything. I'm like, I promise. Let's go through the CPT code book. We're going to talk through them. I'm going to tell you what I've learned in the 5 years that it took me researching how to do it. And we're going to come to a really good solution that you're going to see. This is amazing of what we can offer patients to actually help turn their life around to what you said, patient benefits, provider benefits, but also the third is the payer benefits, right? If we can decrease hospital readmittance, we can decrease medication usage, we can do so many different things to improve the quality of care that not just helps the provider and the patient, but it actually helps the payers at the same time too. So we do sit down every single week with the patient for almost an hour to say, here's what we're educating on today. We're going to get moving. We're going to get active. We're going to talk through your nutrition. We're going to go through today. If your whole thing is about fatigue, we're going to talk through the 50 different ways in which fatigue happens in the body, when it happens, how it happens, everything that goes into the hormones that play into it, every single thing around fatigue that we can educate so you can start making better decisions to continue a lifestyle of change.
And I want to clarify that because there is a wellness coach that's there. So it isn't just, I'm going to give you all these things that could be wrong, get out of here. They're going to leave with a plan, right?
Oh yeah, they have. So we actually make patients take a quiz every visit too. So we actually have documented educational information that goes into their chart every visit. We also give them quizzes. And then on the nutrition side, we continuously update their nutrition plan, their macros, their breakdowns, what they ate, how that made them feel.
Are they interacting with an app doing this?
Yeah, we have full interactions with our team on the app as well, to where we can sit down and say, this is exactly what's going on, and this is exactly what we're doing to fix it. And it changes weekly. We update it, we modify it, we make tweaks, we do everything we can, because you and I both know if you see a patient once a year or even once a quarter, you're not going to change anything for them, right? And if you just do a regular functional medicine program, which usually lasts a month to 3 months, or if you're lucky, 6 months, you have them for a short amount of time and then they're gone. And most of them can't afford another functional medicine package again. So you lose them, right? So for ours, you have to stay in front of the patient. You always have to stay in front of them to encourage them, to support them, to make tweaks, to be objective, to not let emotions get in the driver's seat of what's going on, and continue to be there with them. And again, insurance covers it, which is great.
Bring up with Stephen. We had a Zoom meeting right before this, a business meeting, and one of our partners is helping out somebody who has lots of doctor's appointments, who is in the tail, really the end stage dementia. And what did Stephen, so now he's taking them to multiple doctor visits all the time.
Sure. And his biggest complaint was the lack of human interaction, the lack of being able to connect with the provider.
Yep.
There was actually a vested interest in his well-being rather than in checkbox leave. And he says it's just the most disheartening thing. And he's not even the patient.
Yeah.
He's literally helping someone who's having a very tough time. And there's just no human investment in that patient for that physician, probably because he has to see so many people. But the inside of that, or the other side of that, is what does that patient do? And so it just sounds to me like what y'all offer is even bigger than what's missing.
And also has empathy, right?
Sure.
When you think of human interaction and you think about when we all became physicians to begin with, the Hippocratic Oath, right? Do no harm, right? For me, that means when I mean I'm not going to do any harm to the patient, that means I'm going to create a system and a model within my practice where we can stay in front of that patient to walk through their life with them, right? Why do you think counselors and psychiatrists are typically so effective for their patients? They don't see them once a month or 3 times a year. No, they're seeing them often, right? And for us, when you look outside of just the brain and you look at everything else within lifestyle medicine, it can't be any different. Right? You have to have that human interaction. You have to have empathy, and you have to really have the desire to walk through every single bit of that situation with the patient.
It's interesting because that you bring up the coaching, and I can't remember who it was, but it was at one of the conferences that I was at. I believe it was with Dacia, and someone likened what you just said to, if someone has bad habits and they're so far off track that just coming in, just like you described, for one encounter is more than likely not going to do anything if they don't at least get material and move on, in the same way that somebody who is an alcoholic doesn't just go to one AA meeting and suddenly walk out and say, I've got the book to beat this.
That's actually a really good analogy.
Yeah.
So, I mean, there's, if it's metabolic disease, if it's chronic pain, if it's something like that, and it's related to a lifestyle choice, clearly you need support so that you know how to navigate when that choice becomes tough or that effort becomes more difficult.
Yeah. I mean, you hit the nail on the head with that. I mean, you can't solve a diet or going into an alcoholic, you can't solve it in one visit. Get the book, get the coin, you're good, right? It doesn't happen that way.
Yeah.
It's the same thing with anything else.
And it's okay to fall off, because then you get
Everybody
reset.
does. Where nobody's perfect.
Right.
And one of the things in our training that I have all my training managers and all of the people say, and I can't tell you how many times my team has heard me say this, but it's a single statement that is worth its weight in gold. It's pursue progress, not perfection. Because you're never going to be perfect. You're always going to fall off. But you have to be able to say, okay, what did I learn from this? When I fell off this time, even if you lasted a month or 2 months and you were doing great, and then you do something dumb, and then you feel like crap when you mess up,
Right.
right? And you're like, okay, maybe there's something to this. Maybe I should keep going. And having an accountability person with you that whole time as you go through your lifestyle transformation and create a longevity for your life is everything. And we haven't even talked about the statistics of changing back when you look at age, right? When you look at biological age, I mean, there's so many books out there right now. Yeah, I mean, you look at Hyman had a book on age, and then you have what's the other guy? They're one of the other.
I went on Gabrielle Lyon's podcast, which is,
Yeah,
it's the maintain
She's
muscle
a stud.
mass.
Yeah, she's all about muscle mass, skeletal muscle mass.
for longevity. Peter
Yep.
Attia with his recent book.
That's the other one. Yeah. Yeah. Outlive was Atia's book. And everybody talks about it, right? If you can actually turn back the rate of aging a year to 2 years for every adult in America, you save billions in the economy. People don't realize aging is brought on by so many metabolic processes, right? There's so many things that go into what causes aging and the rate of aging. If you can slow down the rate of aging, and obviously a lot of it goes into epigenetics, right? When you look at the epigenetic trends, and everything right now is heavily into genetics, right? The epigenetics,
Explain what epigenetics are.
lifestyle genomics. So one of the best definitions I've ever seen is your lifestyle washing over your genes. And when you look at what epigenetics is, it's the lifestyle in which you live washing over the genes that you have and your genetics, right? If you can improve your lifestyle, so I use a light switch analogy, right? So if there's a light switch on the wall, the closer I am to that light switch, the more likely I am to flip that switch on and off. And every single person has different diseases or processes or conditions that, based off of their epigenetics and their lifestyle, they can either flip that switch on or off, right? You look at diabetes, you look at heart disease, you look at so many GI conditions, right? When you look at epigenetics, the better lifestyle you live, the further from that light switch you're going to get. So let's not continue to make decisions that get us closer and closer to that light switch, and use a lifestyle that washes over your genetic expression in a way that it actually promotes a longer and healthier lifestyle, that instead of getting diabetes, if you're going to get it, instead of getting diabetes at 50, you get it at 70. The amount of, not even just from patient quality of care in life, right? When you look at from the traditional insurance model, the amount of money insurance would save if they understood preventative and proactive care, that gap of 50 to 70, that 20-year gap, the amount of money they would save on that patient, they're starting to understand that's a lot of money. And if we can implement things that prolong or delay the onset of that condition, we're going to save a lot more money. And that's where epigenetics and lifestyle, and that's why lifestyle medicine exists now, because there's so much going, and that's why Lyons and Atia and all those guys are just dominating the market, because they're showing people what a healthy lifestyle is actually going to physically do in your body. And now we can test it. You can actually test epigenetic trends and get reports on it. You can check people's rate of aging. And that's why I love what we do at Naviwell, because I can say, just by sitting down with you for 6 months or a year, I can look at your reports if we do some of the tests that we can show this. And I can say, your rate of aging was significantly higher than it is now. So if you're 50, aging at a 50-year-old, it's going to show about a 1x rate of age, right? But if you're 50, aging at a rate of 75-year-old, that's significant changes in your overall epigenetic traits and how your body shows in your lifestyle. But if I can say you're coming in at 50, your rate of aging is a 1.2 or 1.5, we use Naviwell programs, lifestyle, nutrition, exercise, stress management, even things as simple as hydration, right? We do these things and we can show objective progressions that now your rate of aging is a 0.8 or a 0.7. You're delaying any kind of epigenetic shift that the patients are having. And we can prove it now. Science can actually prove how we can improve lifestyle for patient care.
Even beyond saving the money for an insurance company or something like that, what I really think that the service that you offer through Naviwell is you're showing people how to reclaim their own domain and their own control over their own life. If you submit and you suddenly find yourself riddled with various chronic diseases, et cetera, you're not really getting to choose your path. If you're constantly having to do certain things just to make certain that you're not in pain or that you can get around or whatever, nobody wants to live like that. It sounds to me like what Naviwell offers is the opportunity for you to say, here's a game plan for you to almost always be in charge or put yourself in the best position to always be in charge of your next day.
Yep.
Well, let me bring something up on this also. It's something that gets missed all the time. When somebody has uncontrolled diabetes, difficult to control hypertension, obesity, cholesterol, and they show up and they're on 3 blood pressure medicines. They're on really high dose cholesterol medicines and the diabetic medications that they're taking. And as physicians, the cardiologist is giving, or the nephrologist is giving the blood pressure medicines, and, you know, the endocrinologist is giving the diabetic medications, and the primary doctor is giving other medications to help them sleep or anxiety. There's a shit ton of side effects going on that we are completely ignoring as doctors.
Oh, a ton.
So when you take back your health and you start decreasing some of these things, a lot of these things that make you feel bad, like it just drove me nuts. I had a guy in, totally healthy, likes to work out, worked out his entire life, and 78 years old. And I'm like, well, how's everything going? And haven't seen you in a couple of years. And he goes, man, he goes, they put me on that cholesterol medicine and I can't work out anymore. My joints hurt. I'm like, you're 78.
Right?
Your cholesterol went up a little bit, and knee jerk is to put you on this medicine, and now you can't do the one thing that has kept you young.
Yes.
He shakes my hand and it's hard, you know?
Yep.
And I'm like, I don't want to be your doctor, but the first thing I would do is get you off that medicine. Let's not look at the labs. You're 78. You work out every day. You lift weights. That's way healthier for you.
Oh, way better.
I mean, that speaks to where you began this whole conversation, which is lab results. Individual do not. It's individualized. It's not some blanket term. Oh, that's high cholesterol. I mean, it's insane.
And even the traditional lipid panel is a joke to some.
Totally agree.
Who did we have on our podcast? What's her name?
Come on.
Where we went deep into the lipid panel.
Kate Shanahan.
Kate Shanahan.
Yeah. So I'm obsessed with cardio IQ, and there's so many different advanced cardiovascular diagnostic lab tests that you can do. I mean, there's over 25 different tests that you look at the LDLs, the subtractions, the size of the particles, the movement of the particles. You look at the cardiovascular inflammatory level. I mean, there's so many different things that when you just look at the shifts in triglycerides and LDLs, I mean, he could have just done a couple little shifts that creates a huge change that now a doctor's putting him on a cholesterol medication. Why?
Exactly.
Did you look at a bigger picture of his cardiovascular health? No. Come on, he's 78.
Or you have the guy, Asim Malhotra, who found all the data that shows what's the best it could possibly even improve a cardiovascular risk, like less than 1%.
4 days.
Yeah.
Total, all the meta-analysis combined, taking the statin adds 4 days to your life.
Yep.
Significant increase in diabetes, significant increase in dementia, significant increase in the muscle stuff. Yeah. You know, that's a whole separate thing. But
even the dementia alone, don't get me started on the connection with dementia and all these cardiovascular meds.
Oh my gosh.
Yeah.
I don't even want to go there because dementia is my massively transformative goal when we start talking about what do you want to do before you exit this earth. If I can cure dementia, that's my thing.
Yeah.
And the irony is that what we're talking about is taking the health into your own hands at an early enough age.
Yeah.
Probably is the best method.
Yeah.
Rather than have these large pharmaceutical companies doing studies on demented people to see if they could move the needle at all a little bit.
Yeah.
We just saw that recent study that Mike sent us where there's some researchers that now feel there's an autoimmune component to the beginning of Alzheimer's dementia.
Oh yeah. Alzheimer's, there's so much correlation. I mean, that's why I call it type 3 diabetes now.
Yeah.
There's so much going into type 3 diabetes as Alzheimer's. And dementia is, I mean, when the brain goes, the person goes. I don't care what anybody says.
Oh.
And that is, I mean, seeing my grandfather, my dad's dad, he had dementia, had all sorts of neurological issues late in life. And I can't tell you how many patients I've seen over the years that already have Parkinson's or you name it, right? There's so many different things that when they come in, I'm like, I wish I could have talked to you 20 years ago. I wish I could have talked to you 30 years ago or even 10 years ago, right? It doesn't matter what anybody says. A prescription and a drug is never going to be the cure and treatment for dementia. Anything neurological.
Well, we have all this data that now shows that, 15 to 20 years before dementia starts showing up, they looked back and retrospectively and people started complaining of gut issues.
Oh yeah.
That's when gut issues started showing up in their life.
Oh yeah.
And then ultimately that led to that.
Yeah.
So I think when you're saying what you're doing is you're empowering. Naviwell allows the person to empower themselves so that they can take control of these factors that you did a very good job of describing the epigenetic component of it so that you get further away from that light switch. And I think everyone would say, I totally would do that.
Yep.
But what you really need is somebody to say, okay, your biggest move the needle things you need to do with your questionnaire and you're in this bucket, we're going to start with this. We're going to start with this. Just like you were saying, it's like, okay, well, I'm already, somebody shows up, they're obese, they're not sleeping, they have diabetes, but they're like, but I got an LED light. And I walk out in the morning, I cold plunge.
Right.
Yeah, exactly. I think I think what you just said right now is Naviwell can empower the person to make the major changes to get them further away from that light switch.
Yeah. I don't know what the number, since you've kind of gotten in and kind of cracked this code of utilizing CPT codes and insurance, something's kind of occurred to me, but you remember there's an interview last week with Casey and Callie Means. And one of the things that they discuss on there was that because I think it's in Obamacare or something like that, that insurance companies at first were just made because they were capped at 15% of what they charge in premiums total could they keep. So they basically have to pay out 85%. I hope I'm not butchering this, but one of the things that they were also given was uncapped premiums. So basically it's actually reverse engineered. Now it's almost like they try to find partnerships with either pharmaceutical companies or hospitals or ACOs in order to spend, because if they spend more to increase that 85%, then naturally their 15% goes up. And I don't know if this applies, but basically what maybe Naviwell does and other similar models is it allows the insurance company to now find new places to spend for that 85% to reclaim 15%. And it just so happens that you're helping make the patient healthy.
Correct.
So what that says to me, if I'm a patient and I've got insurance, I still get to kind of dictate where my insurance company is going to spend their 85%. Why not spend it in a service that's actually going to give me more control, make me feel better, and keep me away from the meds? If my insurance company needs me to spend the 85 so they can keep their 15, I may as well put the money towards somebody who wants to help me. Versus something that's going to get me in this hamster wheel of new drug, new procedure, new hospital stay.
Well, if I'm the patient also, I'm already paying the premium.
Hell yeah.
I'm already paying the premium. And as it turns out, if I'm looking at my monthly med cost and it's $600, then I can look at this and be like, well, I'm already paying the premium. I might as well take some action that will positively affect my life and may bring down my monthly cost of these meds so that I'm actually making some money in the back end as the patient.
For the patient and
for the patient
and the payers.
And the payer. And I'll bring this up because if there's a provider listening to this, this is not going to create more work for my staff. You've came in and you've done onboarding. You met my staff. You met everybody. We took a good look at my patient population, and you specifically went out and found a health coach and a dietitian that matches both my office and my demographic of patients and the type of patients that typically come into my office and what they have. So it's not a extra work on the doctor, which is what, if I'm a provider, I'm thinking, man, that'd be great to do, but I'm already overworked. And it's like, because it's a handoff and it's over here. It's integrated to our electronic medical system. So it's in the patient's chart and everybody can see it. And the patient gets the benefit. They can have repeated visits. We can start seeing the improvement. And these chronically ill patients that require a lot of our time then can start living their lives and not have to wait to have an appointment to see me or my physician assistant.
Yeah, it's funny because I can't tell you how many providers that I've been working with since then. They'll come in and we'll joke about it all the time because patients will come in and they'll have a list of questions that they want to ask their doc when they come in for their appointments. I'm like, okay, I haven't seen you in 3 months or I haven't seen you in 6 months. And I've been putting together a list of questions I want to ask you. And then you get the deer in headlights as the physician of, no, we got 5 minutes. There's no way you're going to get through these 27 questions you have written down on your piece of paper. There's no way we're going to work through all those. So this allows that time that you spend with the patients to be hyper-focused on what you do and you do really well. And then all the other questions, which are typically 24 of the 27, are more things that doesn't have, it needs to be something that can be walked through that takes time and takes focus and takes support. That so many providers are like, thank you so much for taking so much of this pressure off of me that I can go into my encounters, see my patients, do what I do, and then pass the rest off to your team. It's a great synergistic effect is what I call for everybody to be able to take that off. But yeah, the whole sheet of paper with 27 questions on it, I get that a lot.
Well, one of the things I'm also very excited about, because we've shared so many patients, is that with this new model of the Wellness Clinics of America, that when somebody comes in and if they do have the next need, like hormone therapy, they want to consider GLP-1 agonists and do it right so that they don't lose muscle mass and all these things. If they really want the Ozempic or Ozempic equivalent, or they want some extra treatment, then there's a way that they can go from the handoff to, okay, you're going to go to this clinic, Vario Health, and you can talk to them about peptide therapy, about hormone therapy, about these other things that are the next level. We're covering the bases here, and then you can do this, which is something I've always wanted to offer to my patients, but I don't have the time, resources, nor bandwidth to tackle that, because to do it right, as you know, there's a lot of people jumping on board trying to, and there's a lot of people that are taking advantage of these trends. Hormone therapy. Don't even get me started on testosterone clinics and all that other stuff that is just terrible. But that's also another option. So if I have a patient who's very interested in, they do have diabetes or something, and because I do have patients ask me all the time, would you be willing to prescribe, Ozempic or something equivalent or a compounded thing? And I'm like, the only reason why I won't is because I think there's a right way to do it. And I don't have the resources and time to do this in the right way, to make sure that you're not losing muscle mass, to make sure that this isn't creating gastrointestinal stuff, all the stuff. So that's another benefit, which I'm kind of excited about, especially as you continue to increase the Wellness Clinics of America, especially if this expands with GIA. So this is the test, and we're really excited to offer this to my patients in my clinic. So if you're listening to this and this is something you want to check out, go to my website, kennethbrownmd.com. You can fill out a form there, and we could get you in to see gastroenterologists or come in and say, I want to be part of this whole Naviwell thing. You just have to be a patient of mine to begin with. And then if we prove this concept, then I've got 6 other providers in my office that I think would be pretty excited to get involved. And then we've got 1,600 other providers in the country that hopefully hear this and go, that's something I want to offer my patients also.
Exactly. Plan is to help people. You got to do it by working together, working as a team, and expanding ways to get in front of patients' faces and to work with them. And I'm thankful for GIA, thankful for you, thankful for that sauna conversation. And there's really no telling where we can take healthcare if we really focus on education and patient empowerment. So,
yeah, when you came to the office after you left, your first patients for Naviwell are my staff.
I love it.
Because they're all like that. I want that. And the first thing they said is, how much is it going to cost me?
Yeah.
I'm like, you have the same insurance I do.
Yeah.
It shouldn't cost you anything.
Correct.
And so that's really exciting. And I'm excited to see that because we're going to get firsthand experience of the staff being part of it.
Working through it,
working the kinks out, doing this.
I love it.
This is the way that my staff has always been. Everything that we've developed, including we've done some suppositories and things like that. All the staff try it first. I'm like, everybody, these suppositories came in the mail. We got to see which one of these melts.
Let's go.
Let's go.
Let's do it.
A picture of all the staff holding their suppository, and then they go try it. And I'm like, how'd it go? And they're like, didn't go well.
Right. They must get some good bonuses, man.
They're awesome staff. And that's one of the things is that we do have our hangups in the office, and it all comes down to access because we just have a busy office. I got great partners. I got incredible partners. That's the beauty of having really good partners, and everybody's really busy, and we all want to offer something like this. And the staff is amazing. Once you make it through the door, then we can offer that customer care. And this is just the next level of customer care that I'm excited about.
Me too.
We're going to offer it in the show notes, but do you want to tell people how they can learn a little bit more about
Naviwell? Yeah. So easiest way to do it is just go to the website, naviwellgroup.com. If you're a patient or a provider, there's 2 different sections, 2 different pages based off of which one. If you're a provider and you're interested in utilizing the Naviwell program, we have an entire questionnaire that kind of gives us an idea of what to expect for your practice. And as a patient, you can obviously sign up and become a patient. And if you're in an area of one of the locations, and obviously we can fit you in from there. If not, we're growing pretty quickly and we're expanding, thankfully. And if we don't have anywhere close to you now, then we'll start looking and find somewhere for you.
That sounds great.
Awesome. Austin, thanks so much for hanging out with us today. Ken, anything else?
No, it's great. I'm just super excited to try this and offer it to my patients. The fact that my staff are the most excited to try it out, they will be able to then tell the patients, no, you're going to want to do this.
You got to do it.
Yeah.
Yeah. I love it. Well, let's start helping them. I'm excited.
Great.
That was awesome. We'll see y'all next time.
Thanks for coming in. Take it easy.
Thank you.